Greetings, I'm Cliff Rosendale and I would like to tell you about a two-day event which will be presented by Skin Cancer Symposiums in Melbourne in November 2026. This will be in the form of a hands-on workshop involving multiple expert presenters from specialties including general practice and plastic surgery. Now, one of my presentations will be on the fundamentals of skin cancer surgery, how to decide on the best procedure, how to greatly reduce the risk of wound failure, and very importantly, how to orientate the alignment of an excision, bearing in mind any additional surgery that might be required. In 2021, Sharad Paul published Biodynamical Excision Skin Tension, or BEST, lines. He did this by measuring the tension required to close a wound in various directions after removal of a circular specimen of skin. This contrasted to relaxed skin tension lines, or Langer's lines, which corresponded to closure after an incision. Now, you can see that on the limbs, for defects less than 8 millimeters, it did not matter. You can see here on the forearm, the relaxed skin tension lines could be followed for small defects and also on the thigh and the leg. But for any larger excisions, the best lines run longitudinally on the limbs. Now, here we have a case which illustrates the importance of this. A lady with a lesion on her medial thigh. It was suspected of being a melanoma and it required an excisional biopsy. Now, you can see that the relaxed skin tension lines appear to run transversely, and the doctor who did the excision biopsy did it in the transverse orientation. That would have been fine if it was a small BCC, but the problem was it was an invasive melanoma. And when the patient required re-excision, she elected to go to a plastic surgeon, and he looked at the orientation of the excisional biopsy and made the comment, "What am I supposed to do with that?" He proceeded to re-excise the lesion in the orientation he was now committed to. And of course, with a re-excision for a melanoma, it goes wide and deep through the full thickness of the fat, which divides the lymphatics. In this case, it was an unfortunate outcome for the patient. Interestingly, the effect of removing tissue on the scalp is such that Langer's lines and BEST lines are orientated at 90 degrees to each other. You can see that Langer's lines on the left are in the sagittal plane, while BEST lines on the right are in the coronal plane. I would love to catch up with you in Melbourne on November 7 and 8. Thank you.